What if I told you that one small valve in your heart determines whether you live a healthy, energetic life or face silent danger? You're probably thinking, surely not just one little valve. Well, believe it or not, there's a tiny but mighty guardian in your heart that plays a pivotal role in your overall health. And you may not even know it's there. It's the aortic valve, the gateway of life. In this video, we'll reveal all its secrets, explaining how it works, what happens when it fails, and the latest treatment options. So stay tuned. You won't want to miss this. Part 1. What is the aortic valve? It's tucked away between the heart's main pumping chamber, the left ventricle, and the aorta. The largest artery in the body lies a remarkable structure known as the aortic valve. Its primary role is to ensure that blood flows in only one direction from the heart to the rest of the body. To understand its function, imagine a busy intersection with traffic flowing in one direction. The aortic valve acts like a one-way door, preventing any backward flow and keeping the traffic smooth. But it's much more than just a simple valve. It's part 2. How does it work in every heartbeat? Every time your heart beats, a complex interplay of muscles and valves orchestrates the flow of blood throughout your body. The aortic valve is one of 4 crucial valves in your heart, and its job is to make sure the blood flows the right way. When the heart beats, the left ventricle pumps oxygen-rich blood into the aorta, the main artery that supplies blood to the rest of the body. The aortic valve opens to allow blood to flow out of the heart and then closes to prevent it from flowing back in. This opening and closing action happens with every heartbeat, ensuring that the blood keeps flowing in the right direction and that vital oxygen reaches every part of your body. It's a perfectly timed dance that keeps you alive and active. The aortic valve doesn't work alone. It has a partner, the aortic valve, which is located on the other side of the heart. Together, they form a coordinated system to keep the blood flowing smoothly. As the aortic valve opens, the mitral valve closes, allowing blood to flow from the left atrium to the left ventricle. When the aortic valve closes, the mitral valve opens, letting fresh blood into the left atrium. This synchronized action ensures that blood moves efficiently through the heart, delivering oxygen to the rest of the body without any backflow or mix-ups. Part 3. Common aortic valve problems. Over time, the aortic valve can face issues that hinder its ability to open and close properly, disrupting the smooth flow of blood and posing potential health risks. 2 common problems are aortic stenosis and aortic regurgitation. Aortic stenosis occurs when the aortic valve becomes narrowed, restricting blood flow from the left ventricle to the aorta. This narrowing can make it harder for the heart to pump blood, leading to symptoms like chest pain, fatigue, or dizziness. In severe cases, aortic stenosis can cause fainting and even sudden death. If left untreated, aortic stenosis can lead to heart failure, where the heart can't pump blood effectively, causing fluid buildup and affecting the body's ability to deliver oxygen and nutrients. Aortic regurgitation, on the other hand, happens when the aortic valve doesn't close tightly, allowing blood to leak back into the left ventricle. This means that some blood doesn't get to the body, and the heart has to work harder to pump enough blood. Just like aortic stenosis, aortic regurgitation can also lead to heart failure and other complications if not addressed. For many people, these conditions can be silent, meaning they don't show any obvious symptoms, which is why regular checkups are essential for early detection. Part 4. Diagnosis and tests. Diagnosing aortic valve problems involves a combination of listening to your heart sounds, checking for symptoms, and performing various tests. One of the most common tests is the echocardiogram, a non-invasive procedure that uses sound waves to create images of your heart. During an echocardiogram, a technician places sensors on your chest and back to listen to your heart sounds. These sounds, known as heart murmurs, can provide valuable information about the condition of your aortic valve. If necessary, your doctor may also use a CT scan or MRI to take detailed images of your heart and valves. These advanced imaging techniques allow doctors to see the structure of your heart in greater detail, helping them diagnose and monitor conditions related to your aortic valve. Part 5. Treatments and advances. Fortunately, there are several treatment options available for people dealing with aortic valve problems. Medications can help manage symptoms such as chest pain, fatigue, and high blood pressure. In more severe cases, your doctor may recommend a surgical valve replacement. This procedure replaces your aortic valve with a mechanical or biological valve. Mechanical valves are designed to last longer and are often used for younger patients who are more active. Biological valves, on the other hand, are made from animal tissue or sometimes your own tissue and are a good option for older patients. However, there's a newer, less invasive option called TAVR, or Transcatheter Aortic Valve Replacement. TAVR is a cutting-edge treatment for aortic valve problems that's been transforming the way we treat these conditions. Unlike traditional surgery, TAVR doesn't require open heart surgery or a lengthy recovery time. Instead, the new valve is inserted through a small incision in the groin and guided to the heart using a catheter. Once in place, the new valve opens and blood can flow through it normally. TAVR is a great option for those who aren't good candidates for open heart surgery, such as elderly patients or those with other health conditions. It's a game changer in the field of cardiology, offering hope and better quality of life for many. You've now unlocked the secrets of the aortic valve, a component of your cardiovascular system. Hopefully, this video gave you a better understanding of this important valve, its function, and the potential issues that can arise. Remember, your heart is the engine of your body, and the aortic valve is a crucial part of keeping it running smoothly. It's like a well-oiled machine. Your heart needs all its parts to work together seamlessly to keep you healthy and active. By understanding the role of the aortic valve and taking care of your overall health, you can help ensure that your heart continues to beat strong and healthy for years to come. So, how did you rate this video? Do you find it useful or informative? Let us know in the comments section below. Hey, and don't forget to like this video and share it with your family and friends, because by sharing, you care. Subscribe to our channel and hit the notification bell icon for more videos like this. Stay healthy, stay informed, and above all, stay alive.